Good morning. So it is around 8:22 in the UK time. I am travelling to London today to meet Dr. Emma on the Bad Skin Clinic. I am quite nervous because I don't know what treatment they're going to offer me or what they're going to say about my facial keloids. But yeah, it's a process, it's a journey. I'll keep you updated what they say when I get to London. I think my train's at 9:12 and the journey altogether about 3 hours 19 minutes, so I'm not going to get there until lunchtime, so I'm going to grab some lunch, and then my clinic time is at 2:30 at the clinic, so then we shall see what Dr. Emma is going to say. I will try do some BTS and show you what it looks like if I can, if possible. If not, then I'll describe it to you. Not gonna lie, the journey so far hasn't been the best, especially from getting from Bradford to Leeds, and now I'm just waiting for a train to come in that I don't have a seat booked on. It's a bit frustrating actually when my anxiety is literally like all over the roof at the moment. It's like going up in the air, so I literally don't know what to expect.
Going up. Doors opening.
Hiya, I'm Bianca. I've come to see Dr. Emma.
Great, if you'd like to take a seat.
Thank you.
Hi, Bianca. Hi, nice to meet you.
You too.
Come with me. There, come on in and have a seat. And this is Rosie, he's our nurse. So I'm guessing that you've come to see me about the keloids.
I have, yeah. The keloids on my jawline.
Was there an injury to the skin beforehand? Do you think you had some acne, which is normally the trigger?
I had severe acne when I was around 12, and then after that they just kind of grow out of control.
As you've kind of gone through the rest of your teenage years, have they just continued to spread across the face?
Yes, they just continue to grow. I have had them cut out before and they grew back.
And so you had them cut out. Tell me about that. How old were you? What kind of treatment did they do?
The first time I got them cut out must have been around when I was 19, 20.
So they quickly came back?
Yeah, within around 8 months that time. And then I got my left side cut out a second time and that grew back quite quick. About 4 months it grew back, started to grow.
With steroid injections as well?
Yeah.
And what do they actually feel like day to day to you? Are they itchy? Or are they
So they
hot?
itch and the burn, and sometimes I get like a shooting pain.
Yeah. But you're here to get treatment for them because you don't like how they look or don't like how they feel?
I think it's both. Even though I am this bubbly, confident person with them now, I feel like it's my time to try, get rid of them, and if nothing works for me, it'll be my last time trying, really.
Okay. So do you mind if I get in and have a look at these? Is that okay?
That's fine, yeah.
Thank you. What we can see here is the keloid, and you can see the outline of it pretty well. And there's a couple of small little ones just in here. So individual acne lesions, they will have scarred over and then they will have turned into the keloids. And turn your wee head around this way. And we've got the keloid on this side, but it almost looks like it's been two because we have this line and then this little curvy line. But it's much flatter on this side, but it is raised on the edge round here. Well, it's really, in your case, it's more something called a keloidal disease, really, rather than just individual keloids.
Okay.
You're getting them in response to just even small injuries. What happens is the fibroblasts, these cells, come in and make the collagen, and then they keep making more and more, and it just gets bigger and it gets bigger. So we need to find a way to switch off that repair job, really. And you know how difficult these are to treat.
I do.
The first line that most people do is to inject them, either with a steroid or a chemotherapy agent, and you've had that done. The additional thing is that we then can go on and intervene with surgery. But for many, many, many people, If the surgery is not done where it's removed the whole bulk of that tissue right down deep and to the edges of it as well, it comes back like what's happened to you. But what we know is that the best chance of getting rid of it and not coming back is to do the surgery the correct way, and then to have radiotherapy afterwards.
I've never had someone mention radiotherapy before, so that's quite a new venue to go down.
The radiotherapy puts electron beams under the skin, and it essentially stops the overhealing wound response that you would get. It lets it do the initial job of the repair, and then it's like, okay, that's enough, you can stop this part of it now.
I know it's going to be probably horrific for me for obviously having treatment again. However, I feel really positive about that. Even if it was flatter or a little bit different, I'd be happy.
This operation really needs to be performed with somebody who's used to doing a lot of them to try and give this the best chance that it'll not come back. So I'm going to refer you to the plastic surgeon, Mr. Goodis.
Thank you very much. I'm just excited to see what happens.
Me too.
So I've just had a consultation with Dr. Emma and it actually went very well. Could be possibly surgery and radiation, but we are going to see what happens.
This is a risky operation. She has had these treated in the past and they have recurred. And now we really have to ensure our very best to make sure they're not going to come back, because every time they do, they will get bigger.
I'm not getting my hopes up too much because I do know keloids grow back, but I feel like going forward, this is the best decision I've ever made. Make sure you subscribe to see the rest of my keloid surgery journey.